If you think the price of winning is too high, wait till you get the bill from regret.
You may be asking, what does that quote have to do with dentistry? I'm glad you asked. Welcome to another episode of Ask Dr. J. So I heard Tim Grover say this quote at an event, and it really got me thinking about the patients that I work with and the lives that I transform and how it can help other people. And for those of you who don't know who Tim Grover is, I would recommend that you look him up. So I was at an event and I heard Tim Grover deliver this message, and I immediately thought, I have to share this with my patients. I have to help them understand the true cost of the decisions that we make. So I come across patients and people all the time who maybe don't understand the true value of investing in proper dental care. And sometimes I think they're only thinking about the monetary costs. However, there's a lot of other costs, and I want to share a few of them with you. So let's go ahead and talk about the elephant in the room, the money. I want you to think about this. If you don't go for your oil change time after time, eventually you may have to replace the engine or some other large part of the car, which is going to be a lot more expensive. Or if that check engine light comes on and you don't take it in, it's going to be a lot easier and a lot less expensive to drive the car into the dealership or the shop yourself than to end up on the side of the road with whatever situation may have occurred with your car. A lot easier, a lot less expensive. And it's the same thing with your dental care. The fact of the matter is you can't afford to not do what you need to do now. It's going to be more expensive in the future. So what other costs are there? There's what I like to call biologic costs. And this is where when something happens, it can't be undone. So yes, we have implants and I love to place them and help people. But the fact of the matter is when you lose a tooth, you can't get it back. We can replace a tooth with an implant, but it's not the same as your own tooth. And on top of that, when you lose a tooth or you lose teeth, if you lose bone, it's really hard to get that back. Yes, we have techniques to do guided bone regeneration or bone building and grafting. And again, I love to do this and help people, but it's a lot more expensive and it's a lot more things that you have to go through to get to the result, where if you had just looked at it up front, you wouldn't be doing that. And another cost is the emotional cost. And this one maybe people don't think about as much, but the cost of self-confidence. So if you're maybe not happy with your smile, missing a tooth, covering your smile, and lacking self-confidence, there's a lot of things that you may miss out on. You may miss out on possibly job or business opportunity. And not because your smile is not correct, because you don't have the confidence to maybe step forward and take action on that opportunity. Or possibly even personal relationships. If you're not feeling yourself, if you're not present in the moment because you're thinking about your teeth or what's wrong with them, even subconsciously, you're not going to be present in the moment to be your full self, to build a personal relationship with someone that you may want to. So again, these are some of the costs. There's many others, but think about that. The fact that the money's going to get more expensive, the teeth and the bone are going to get worse, and whatever other biologic costs. And emotionally, it can be a cost that we can't even quantify. And the only regret that I've ever had a patient tell me that's had life-changing dental work or stayed on top of their work is, I wish I would have done it sooner because of the time that they lost from not making the change and the confidence booster that they got and the health change that they got and the ability to eat. They wish they would have got it done sooner. In fact, last week we just had a patient that came in that had a couple missing teeth in the front and signed up to get them replaced. We were going to do implants. Perfect candidate both clinically, and she got approved for the loan that she needed to get approved for, and then she backed out because of the fact that she thought that the monthly payment was going to be too expensive. And you know, I know it's important that we have bills, and I'm not trying to tell you not to put food on the table and take care of those things, but there's considerations that I think maybe that person could have made to be able to take care of that, because now this person, who's a business owner by the way, maybe is missing out on opportunities for new clientele for their business and new sales and new relationships that will help them thrive that we can't even think about. It's a ripple effect that when one thing changes, other good things come. So I hope this segment provided some insight, and again, I'm not making light of the weight of the financial decisions that you have to make. I just want to make sure that when you're making these decisions, you consider all the costs, not just the financial ones. Thank you for tuning in to another episode of Ask Dr. J. And for those of you who don't know who Tim Grover is, I would encourage you to look him up. Have a great day.